COVID-19 vaccine will likely be on the 2023 list of recommended child and adult immunizations. This comes after a CDC advisory committee voted to add the vaccine. 5 News reporter Catherine Gilker tells us what the governor says about this recommendation when it comes to our state. Catherine?
Governor Asa Hutchinson made it clear that Arkansas will not require children to get the COVID-19 vaccine to go to school. He says throughout the pandemic, he has encouraged Arkansans to get the vaccine, but has never advocated for mandates.
It's very important for parents to understand that parents make the decisions on their child's health and that there's not going to be a mandate here in Arkansas for COVID vaccine in our schools.
The advisory group has recommended the COVID-19 vaccine be added to the 2023 list of recommended child and adult immunizations, but it still needs CDC approval. Hutchinson says the Arkansas Department of Health says it's too soon to provide a mandate for children to get the COVID vaccine. He says when a vaccine is put on the schedule by the CDC, it is eligible for Medicaid reimbursement.
Just because they put it on a schedule, it's not any different than the flu vaccine is subject to reimbursement. It's on the schedule, but it's not mandated. And so that's the balance there.
States like Arkansas will be the ones to decide whether to require the vaccine or not. Pediatrician and Fayetteville Board of Health's Dr. Marty Sharkey agrees with the COVID vaccine being put on the recommended list because it is a vaccine she recommends to her patients.
We need to be protecting ourselves against this. And we know that 2 doses of the primary series for COVID decreases hospitalization in young children by up to 80%.
She says the vaccine being added to the schedule is a good way for parents and pediatricians to have a conversation about the recommended and required vaccines for school entry.
Now, if we were talking about whether this needed to be required for school entry, I don't know that I would be agreeing with that wholeheartedly.
Again, this recommendation came from a CDC advisory panel and still has to be decided on by the CDC. Catherine Gilker, 5 News.
All right, Catherine, thanks. COVID-19 cases have been trending down in Arkansas over this first month of fall. The number of new cases since yesterday, 323. Active cases did rise slightly, but remain below 3,000 statewide. Hospitalizations also fell below 150 tonight, and another 8 patients died after testing positive for the virus. According to the CDC, all the counties in our viewing area are currently at low risk for COVID-19 transmission.